The cervix is the lower part of the female uterus. The green arrow at the bottom left points to a picture of a normal cervix. The red arrow at the top right indicates a graphic of cervical cancer. From left to right, this shows cervical cancer advancing from early to late stages. Cervical cancer can be prevented or at least detected early and treated successfully in almost all cases with regular pap smears. A major contributing cause for cervical cancer is the human papillomavirus or HPV infection. There is a vaccine for HPV that can prevent cervical cancer. It is given in a series of 3 doses and is currently recommended for women under 27 years of age. Pap smears recommendations for women with a uterus are every 1 to 3 years or if you are at standard risk, and every year if you are at high risk. Some high risk categories include the high risk HPV virus infection, abnormal pap smears, or multiple partners. Pap smear recommendations for women without a uterus are if there was no cancer with your hysterectomy, you may stop getting pap smears after 3 normal pap smears. If there was cancer with your hysterectomy, you should continue to get pap smears every year. Please note that if you do stop getting pap smears, it remains important to get regular well woman exams to check your breast and ovaries and other important well woman issues. Vaccinations are among the most underutilized of adult preventive services, and this deficiency is the cause of an estimated 60,000 preventable deaths in the United States every year. Today we shall discuss the influenza or flu vaccine. There are many myths and misconceptions about this vaccine. The following information is based on the best scientific information available. The first myth is influenza is not a dangerous disease, and the truth is influenza causes 36,000 deaths per year in the United States, mostly in elderly and people with chronic disease, and it also causes over 200,000 hospitalizations. Another myth is the flu vaccine causes the flu. The truth is this vaccine cannot cause the flu, and this is perhaps the most common reason this vaccine is not taken. Remember, it does not cause the flu. If you got a flu-like illness in the past after taking the flu vaccine, it was likely a bad coincidence and not caused by the flu vaccine. Please do not let this misconception keep you from getting a vaccine that can literally save your life. The next myth is the flu vaccine is dangerous, and the truth is the flu vaccine is very safe except for persons allergic to eggs or having a history of serious true allergic reaction. Signs of a true allergic reaction are lip swelling, breathing difficulties, or a choking sensation. The final myth is the influenza vaccine is not effective, and the truth is the vaccine is very effective, with up to 70% reduction in hospitalizations and up to 85% reduction in death from influenza. The bottom line on the flu vaccine is get your flu vaccine unless there is a real medical reason not to do so, and this is actually very uncommon. You should also review the adult immunization schedule that is included in your handout and be sure to get all recommended adult vaccines as indicated in that schedule. Depression is a very common mental health condition that causes a great deal of human suffering in terms of decreased quality of life. In its most severe form, it can be fatal as the result of suicide. Depression can be easily detected through a simple questionnaire, and the available treatment is safe and effective. Tobacco use is the single leading cause of preventable premature death and disability by causing lung disease, heart disease, and cancer. There are very effective treatments now available that can help motivated smokers to quit permanently. A final area we wish to present deals with the important issue of advance directives. These are legal documents. You use them to leave instructions for your wishes regarding your health care in the event you are unable to do so. There are 2 major forms of advance directives, the healthcare proxy and the living will. The healthcare proxy is a document that names the person who can carry out your healthcare decisions if you are unable to communicate them. You obviously should select this person carefully and make your wishes clear in advance. The living will is a document that declares your healthcare wishes to be carried out in the event of a terminal illness or a condition where you are unable to communicate. These are 2 resources for you to obtain advance directive information, and you will receive these in your handouts today. You should consider having an attorney check over these documents. This brings us to the end of this presentation. Your medical assistant will have given you a simple checklist and questionnaire corresponding to the preventive services covered in this video. You will have the choices of 1. Giving us your consent to provide or schedule the recommended service, 2. Letting us know you have had the service so we can update your chart, 3. Declining the service or asking for more information before making your decision. If your answers regarding depression or tobacco use indicate the need, we shall provide you with educational material. This is an example of the checklist you should have. All that is required is your placing a check or an X in the box of your choice for each category. In this first example, the red X is placed in a box that authorizes us to schedule you for a colonoscopy or sigmoidoscopy with an intestinal specialist for colon cancer screening. This next example shows a different choice by placing the X in a box that indicates your colon cancer screening is up to date. The rest of your checklist would be completed in this very simple manner. If you have vision or other reading disabilities, your medical assistant will help you. We shall review this information with you and act on the recommendations and information in accordance with your choices. We hope that this video will have answered most of the common questions that arise and will allow you to make the most informed decision possible on these vitally important health services.